The Patient Protection and Affordable Care Act, also known as the Affordable Care Act or Obamacare, was signed into law to reform the healthcare industry by President Barack Obama on March 23, 2010, and upheld by the Supreme Court on June 28, 2012. What is the Affordable Care Act? Most simply, it is the combination of free market impulses and government regulation. Citizens of the United States are now required to buy health insurance, and the Obamacare is an option for a state-run exchange. The exchange is the market for private and public insurance plans. Through this, citizens can choose an option that best fits their coverage and pricing needs. The Act is intended to ensure that all Americans are covered by an affordable, quality health insurance plan and to reduce the growth in healthcare spending. The Act includes a number of provisions to improve healthcare, such as no lifetime and annual limits on coverage, inclusion of all citizens, regardless of pre-existing conditions, prevention of gender discrimination, the ability for young adults to stay on their parents' plan until age 26, and controlling unjustified rate hikes from insurance companies. However, there are a number of unintended consequences accompanying the bill. This bill will have effects on a number of stakeholders. These are businesses, hospitals, doctors, private healthcare providers, insurance companies, drug manufacturers, and citizens. With the Obamacare, businesses will now be required to offer insurance to employees if they employ at least 50 full-time employees. An employee is considered full-time when he or she works more than 30 hours per week. This also goes for part-time employees, meaning that if 2 part-time employees put in more than 30 hours a week combined, they will be considered a full-time employee. For instance, 2 part-time employees who each work 15 hours per week will be equal to 1 full-time employee in the eyes of the bill. Smaller businesses may avoid reaching the 50 full-time employee mark to avoid having to pay for employee health insurance. Research has shown that in low-paying jobs, it is more beneficial for both employer and employee if the low-paying positions are switched to part-time. Subsidies from tax. Hospitals will be affected in a number of ways. One of the ideas behind mandated healthcare was to lessen emergency room visits. This would, in theory, reduce costs to the hospitals because they are currently required to see patients in the emergency room, no matter their ability to pay. However, research has shown that when people have health insurance, emergency room visits actually increase. Insuring 40 million more Americans will lead to a shortage of both beds and doctors. This act also requires a satisfaction survey now be filled out by patients. This survey will reward hospitals with good results and punish those without. If there is a shortage of beds and doctors, it will be difficult for hospitals to satisfy all of their patients and receive good survey scores. Many private healthcare providers, like the New Hampshire Orthopedic Center, whom we interviewed the executive director of, support the act. Although it is not required by the government, currently some private healthcare providers will provide care regardless of a patient's ability to pay. These providers will see an increase in their revenues and profits because they will now be receiving money for treating the people who were previously without insurance and unable to pay. On the other hand, private practices may see revenues from patients with existing insurance decrease. Private practices negotiate with each insurance company to determine what they will be paid per visit. A private practice may be paid a different amount for the same service from each insurance company they serve. For instance, a higher-priced provider may pay the private practice $100 for a doctor's visit, while another provider only pays them $80 for the same thing. Because everyone will now have easy access to health insurance plans outside of their employer, they will be able to switch to cheaper plans if they so desire. The cheaper plans pay the private practices less, which means a lesser profit. The number of small private practices may diminish as the pressures of providing care to a growing number of patients drive some private doctors to join larger groups or become salaried hospital doctors. The volume of patients that the Affordable Care Act creates will put pressure on doctors. The Association of American Medical Colleges predicts that by 2015 there will be a nationwide shortage of 63,000 doctors of all kinds. Workdays will lengthen to try to fit in all of the patients. It is likely that doctors will begin to communicate with patients via telephone and email, leaving the hands-on care to nurse practitioners and physician's assistants. Insurance companies will be largely affected by the new bill. Revenues will increase as more people buy insurance plans, but costs will also increase. Insurance companies are no longer allowed to charge much higher rates to people with more risk factors, such as the elderly and smokers. Rates between risk groups may vary to a certain extent, however. Insuring these people who were previously denied coverage or forced to pay higher premiums will be expensive for insurance companies. To try to make up for this, younger, healthier people will see their premiums increase. Insurers will also have to offer a more generous benefit package, which will be more expensive to them. These costs will likely be passed on to customers by raising premiums. As a trend, insurance prices for the young and healthy will increase, while premiums for the unhealthy and elderly will decrease. It may be cheaper for healthier people to go without health insurance. In that case, will enough healthy people buy insurance to cover the cost to the insurance companies of covering those who were previously denied coverage? If not enough healthy people subscribe, premiums will increase even more to account for the fact that only the sick are being covered. Insurers are also affected by a new law that requires that they spend at least 80% of premium dollars from individuals and small companies and 85% of those from big employers on health-related costs. If they don't spend the required amount, they will be forced to give rebates to their customers. Once administration costs are factored in, insurance companies don't have a lot of room left for profit. Drug companies are expected to benefit from the Affordable Care Act. Prescription drug use will rise as millions more will be able to afford prescriptions. It is estimated that the drug industry will see an extra $15 billion in sales over the next 10 years. This money could be used towards researching new medications, which would benefit society as a whole. The American citizens are most largely affected by the new bill. Citizens will be able to keep insurance that they already have or purchase insurance on the exchange. Medicaid will be available to the poor within the states that offer it. Subsidies to buy insurance will be given to those with incomes of up to 400% of the poverty level. It is likely that people will try to hide income to appear below the income level for which insurance is subsidized. Younger, healthier individuals may opt not to buy insurance and pay a penalty instead. The penalty starts at $95 a year or 1% of a person's taxable income, whichever is greater. It goes up in subsequent years and by 2016 will be $695 for each adult or 2.5% of a person's taxable income. However, fines based on a person's income can't be higher than the cost of buying a basic health insurance policy in their area. The penalty will be paid when paying taxes, which means that someone who evades their taxes may also evade the penalty. The option of the penalty means that some younger, healthier people will opt out of buying insurance. Insuring less healthy people means that insurance companies will have to spread the higher costs of covering unhealthy people over a smaller number of people, which means that premiums may rise. People may also choose not to buy insurance if it is difficult for them to afford and paying the penalty is cheaper. People just above the line for receiving subsidies would fall into this category. As costs for insurance companies rise, their networks of doctors and hospitals may shrink, meaning that people may not be able to see the doctor of their choice. Consider a low-income American supporting a family of four, deciding whether to take a part-time job that pays $36,000 a year or a full-time job that pays $42,000 a year. Accepting the higher-paying job could result in the family losing over $10,000 a year in healthcare subsidies. Moreover, by switching low-income employees to part-time positions, rather than offering them health insurance, an employer will be able to save over $3,000 a year by avoiding Obamacare's employer-made mandate penalties. Without further reforms, many employers and employees will jointly benefit if employers make low-income employees part-timers rather than offering them health insurance. The losers will be taxpayers, who will need to fund the subsidies that these employees will be eligible for. These incentives won't be as extreme for employees with higher incomes, for dual-income families, or for single employees. For instance, a worker supporting a family of four deciding between a job paying $54,000 a year without health insurance and a job paying $72,000 a year with insurance would lose only about $7,000 in annual subsidies by accepting the higher-paying job. The Affordable Care Act will have a number of adverse effects. For Americans, it means access to health insurance for more people. Those who were previously denied coverage because of poor health and those who are too poor to afford insurance will now be insured coverage. This comes with a negative side, however. Covering unhealthy people will be expensive for the insurance companies. Because they are no longer allowed to price discriminatorily, the cost will be passed on to all customers, not just the unhealthy. This means that we are likely to see insurance premiums rise compared to their current levels, especially for the young and healthy. The healthy may be forced to pay the cost of others' unhealthy lifestyles, but it will still benefit the greater good because all Americans will be covered by health insurance. Thank you.